Thank you very much for the opportunity to speak. I'm a long-term complex patient who's had palliative care during COVID-19, although that's been disrupted. I've been shielding for over a year. And I'm here representing the Worldwide Hospice and Palliative Care Alliance, of which I'm a trustee. And I think we all know that complicated mental health impacts of grief and bereavement, such as prolonged grief disorder, post-traumatic stress, and poor bereavement outcomes for family members of those who died during the pandemic, as well as distress in frontline healthcare providers, is a major problem, but it can be alleviated. Research from Bristol University in the UK suggests that we need to do more to, first of all, help people with their advanced care planning. Secondly, ensure proactive, sensitive and regular communication with family members alongside accurate information provision, even if they can't be with their loved one as they're dying, which is clearly suboptimal and harmful both for patients and the healthcare workers. So we should enable family members to say goodbye in person where possible, accepting that this may not be possible in the context of the pandemic. Support virtual communication where that's possible. And for everyone, provide excellent symptom management, not forgetting emotional and spiritual support, as well as essential medicines. And provide and/or signpost post-bereavement services to mitigate the effects of this emotionally. And we need to mitigate effects of this emotionally challenging work on healthcare staff with organisational and systemic approaches, including informal and professional support. The concept of moral injury is developing in the UK, where healthcare workers have their mental health severely affected by witnessing suboptimal end of care, and I'm sure that's a problem elsewhere in the world. How will the WHO seek to integrate palliative care and these responses to reduce mental health impact, both for patients and, importantly, for healthcare workers?
Helena, thank you very much for sharing your experience and your very poignant comment. Would the Secretariat like to respond first?
Yes, thank you, Dana. I would like to ask my colleague, Alisa, perhaps to respond part of it, how it is the situation in the country, and then Fami will get back to something specific about palliative care, if that's okay. Alisa?
Sure, thank you. Thank you very much for this important question raised. And this group of people there indeed required more in-depth help and support. And just bringing in an example from Ukraine, we, as the pandemic, we faced the pandemic in the middle of healthcare reform as well. We were focused very much from the beginning of the pandemic on developing and strengthening essential services, mental health services for people with severe mental health conditions and disabilities, and supporting development of community-based mental health services, which are outreach by nature, and so people can receive this support in their home and their usual environment, and not necessarily in mental health facilities and hospitals. So that was one of the main focus from Ukraine perspective, but I understand that it's not fully answers your questions, but it's just example how we were focused on strengthening essential mental health services for people with severe mental health conditions and disabilities, and who partially require palliative care as well.
Thank you.
Lisa, thank you very much. Khalid, did you want to respond to this question also?
Thank you very much. So I think, as was mentioned previously by a couple of speakers as well, that there is a need to integrate mental health across all sectors. And here I think it would be important to highlight the fact that the universal healthcare packages which are being developed by a number of countries, benefit packages which are being developed, do have palliative care and mental health. So I think there is an opportunity there that we can work and with the countries, it's particularly with some of the countries working psychosocial support provisions and evidence-based interventions become part of the universal healthcare package of services. Second, I think the issue which was highlighted, which probably is equally important, is the workers, the healthcare workers and the frontline staff own mental health, and they are dealing with people with disabilities, with end-of-life situation, or with long-term mental health problems. So I think that's another issue which we need to highlight, and the fact that everybody, whether they are community members, whether they are frontline workers, whether they are health workers, they need to have basic psychosocial skills. And I think Fahmi was pointing out in his presentation some of the packages which are available, which can help build up the capacities, not only to take care of people around you, but also to take care of your own self.